Welcome everybody to another edition of the Kansas State Veterinary Diagnostic Laboratories webinar series on diagnostic medicine. I'm Greg Hanselcheck and I'll be your moderator today. We're very fortunate to have Dr. Steve Ensley as our presenter. Before we get to Steve, just want to do a little paperwork here. Number one, I want to thank our IT group for making sure that this thing actually happens, because without them it wouldn't. I also want to let you know that if you've logged in, that within a day or two, we will send you an email with a certificate for 1 hour of continuing education credit. And also let you know that this presentation will be recorded and then we'll plant it on our YouTube channel. If you haven't been to our YouTube channel, just Google KSVDL YouTube. Please subscribe. We try to plant frequently YouTube or videos on our YouTube channel having to do with diagnostic medicine. The way we do these webinars is Steve will give his presentation. It's about 45 to 50 minutes long, and then we'll ask him questions. So during the presentation, if you have questions, just put them in the chat and then we'll ask him at the end. If by chance we don't get around to asking your question, or if you have a question next week or whatever, do not hesitate to call KSVDL and ask for Steve or ask for anybody else in the laboratory. We'll try to help you as much as we can. So with that, we'll start the presentation. And like I said, it's Dr. Steve Ensley. Steve is a graduate of the Kansas State University, Doctor of Veterinary Medicine. He's spent 14 years in private practice, mixed animal private practice. He then went to Iowa State and got a master's and a PhD. He spent time at the University of Nebraska. He spent time in industry, and he spent time as a toxicologist at Iowa State. And we're very fortunate to have Steve as the head of our toxicology section at KSVDL. So with that, Steve, I'll turn it over to you for your presentation.
All right, thanks. Thanks for the opportunity to talk. Today we're going to talk about small animal toxicology in general, but I wanted to also talk a little bit about our toxicology group here at K-State. We're proud of what we do. We've got a great facility, we've got great equipment, and we've got great people here, which in many of the veterinary diagnostic labs across the U.S., toxicology has been downsized or even eliminated. So we're real fortunate here at K-State to have the facilities and the group that we do have. I've also got Scott Fritz. Scott Fritz is a toxicologist. He's been here 4 years now. Did a residency, took the tox exam and passed that. He's full time here. Has got practice experience. Does a great job. I call him Steve Ensley 2.0. He's bigger, faster, stronger than I am. So the next person I've got on the slide here is Renee Schmidt. She's a K-State graduate also. Her husband's a veterinarian. Renee actually lives in Nebraska. She worked for the pet poison hotline. We use her. She's a resource that we use. She actually comes down and teaches 2 hours of toxicology to our veterinary students during the semester that we teach that. So she's a great resource. A lot of the slides that I'm going to use today are her slides that she has used here, and some are from Dr. Fritz also. So they're not all mine, but I have no trouble using good slides to try to show what we want to talk about today. So we do food animal toxicology. We also do small animal toxicology. We look at a lot of exotic animals. So we get a wide base of cases to look at. And I tell students that the ology of toxicology is the most interesting by far of any of the things that we teach here at K-State, in my opinion. And if when you're in practice, you'll definitely see toxicology cases. They're usually one-off, not not something that you normally see a lot of, but they're always interesting cases, and we try to do a great job trying to prepare all the veterinary students when they graduate to be as competent as they can be, and I think with the class time we get with the students and the classes we get with them, K-State does a great job, maybe the best job in the U.S. of training veterinarians and veterinary toxicologists. So what I wanted to do today is when we work with Renee, she's very helpful about looking at these 10 different toxins that we typically deal with dogs. I included cats in here. We do see those. Also, dogs by far are the most common species that we see issues with. And so these are some of the toxicosis that I just wanted to cover today fairly quickly. We'll try to get through all these and talk a little bit about what we can do here to help you make a diagnosis. So this is a map from the Pet Poison Hotline. You can see it's a color-coded map of the different. It's interesting that geographic location has a lot to do with what potential toxicosis you're going to see. So the purpose of this is just to show you that it's toxicology covers a wide gamut of toxins, and where you practice can have a big impact on what you will potentially see. These are on this slide. These are common tests that we do here in our laboratory. I think everybody recognizes most of these. Some of these are time of year related. Most of these are things that we look at probably every week from the different cases that we get, and I'll talk about those individually. This is a slide that I really like to show. We have a lot of instrument capability here at K-State. Not very many of the veterinary diagnostic labs in the United States now have the ability, have the instrumentation like we have, and have the ability to do testing in-house. That gives us we can work on cases that we need to. We can change the priority. We can look at over long holidays, or typically toxicology cases. All the disasters happen when we're over a long holiday, or always on Friday at 4 o'clock, and never want to answer the phone because you never know what's going to happen. And these instruments that we have here have a lot of capability. They're very expensive. I don't want to tell you how much exactly they cost because they're expensive, and we have to hire. We have 2 PhD chemists that work with us to develop our methods and look at the testing that we do to make sure we're using the latest scientific principles to be able to do the work that we do, and the equipment. We have these all have maintenance agreements on them. We have to have technicians come in at least once or twice a year and tune our equipment, do regular maintenance, so that we have very accurate instrumentation. So one of the tests that we do, not a lot of diagnostic labs have the capability to do this test. We call it a GC mass spec screen, gas chromatography mass spectroscopy. So if you've ever watched any CSI type television shows, what they show in there is exactly what we have in our lab. We call it the unknown toxicant screen, or the CSI screen. If you've had an animal that dies from unknown causes, or you have, we look at feeds, we look at waters, we look at baits, so we can look at a lot of different analytes. And this piece of equipment gives us the capability to do what we call a poison screen. It's not, there is no one screen that we can do that will cover all potential toxicants that animals will get into, small animals in particular. But this one is the next best thing to a poison screen that we have. We do have a part of the analysis is we have an internal library in our mass spectrometer that we can look at. We can screen. It's got over 1 million compounds in there that we can compare what we are able to extract from the sample that we got, if it's blood or GI fluid or tissue or baits, whatever. We've got this library that's very comprehensive. Again, it's not everything that potentially could be a problem, but it's very helpful to look at. So it's a test we do. It's probably one of the more expensive tests in our lab that we do, but we get a lot of requests for this. I talk with a lot of veterinarians about what this test is and if we can do it, if it's appropriate for their case, and if we can use that. But so the GC mass spec screen, it's on our submission sheet. If you have any questions, you can call to talk about it. But it's one of our more common tests that we do in our lab. In the top 10 toxicants from the Pet Poison Hotline or the other call-in centers in the U.S., one of the common issues in small animal canine medicine specifically is the animals get a hold of whatever the humans in the household are taking for their pharmaceuticals. So they inadvertently get access to these compounds, can take those, and mainly because the dose difference between humans and a 50-pound dog is enough that we see issues with these. So as you can see, one of the most common prescription medications that we deal with are these antidepressants, selective serotonin reuptake inhibitors, because they're commonly used in human medicine. So our pets inadvertently get access to these. So we can test for those to try to confirm that's what the clinical signs that you're seeing, that's what the exposure is. But the antidepressants are one of the most common drugs that we're going to look at or that we have questions about. Another prescription medication that's very common, that's high on our list of potential toxicants that we see, are the amphetamines, ADD type compounds that we use. That the humans in the household, take these on a daily basis. Animals get exposed, and they'll readily consume these if they have the availability. And so these are some of the ones that we have some capability to look at to see if that's in fact what's causing what you did see. Most of the time, the samples that we get are after the fact. When you get a toxicology case in practice, those are usually animals are already showing clinical signs, so you have to treat those rapidly. There's rarely enough time to collect samples, send to the lab, have us confirm whatever you think it is, and then you base your treatment on that. So there are some things we can do, but most of the time it's an emergency situation. You're trying to treat the practice, and then take a sample that we can confirm, what you suspected it was. Chocolate, caffeine, these are common toxicants that we look at. Time of year also has a big impact on when we see these. Easter time's coming up, and so this is when we have a lot more availability of chocolate being available to our pets. So we see exposures just due to the availability. So chocolate, caffeine can be in combination. So those are very, in our canine cases, they're very good stimulants. They're in a group of compounds we call the methylxanthines. So we can look for those to see if that's what was causing the clinical signs that you observed and treated, and hopefully had successful resolution of in practice. But we can confirm, what if there's any question about what the potential toxin was. So it's again, chocolate, caffeine's commonly seen. One thing that's a little different about chocolate and caffeine versus some of the other toxicants we look at is they have a fairly long half-life, and so what that means in practice is that typically when we have animals that get exposure to an unknown toxin, one of the common things we do is when we get those animals into the clinic, or even possibly before they get into the clinic, we'll make them vomit to get rid of whatever compound they have. And one thing different about chocolate and caffeine is they have a long half-life. So our typical window of time that we like to induce vomiting after we know an animal got into a toxicant that we want to try to make them evacuate that, so make them vomit and get it out of the stomach, is a 1 or 2 hour time period. Usually after that, the compounds move through the GI tract and it's not going to be in the stomach, so it's not going to be trying to induce vomiting after 1 or 2 hours typically is not helpful, except in the case of chocolate. Chocolate will last long enough. It's a 5 or 6 hour half-life, so we actually have a longer window of time to try to evacuate the stomach. And the activated charcoal, again, a common treatment. It's been called the universal antidote. It doesn't work for everything, so you have to know when and when not to use that. But vomiting is the first thing we use in practice. Activated charcoal, possibly the second thing. Fluids, if needed, if they're indicated. Trying to treat these are the caffeine, chocolate, the methylxanthine groups, theophylline groups are stimulants. So these methylcarbamols, beta blockers, anticonvulsants, depends on where you're at in the exposure and how severely the seizures are with some of these compounds. Acetaminophen is another common compound we see associated with our small animals. Again, because humans are using these, animals get exposure. Cats are more sensitive to the acetaminophen, Tylenol. They're gonna be more sensitive at a lower dose, so we see potentially more issues with cats than dogs. Heinz body anemias and this hemoglobinemia are common clinical signs associated with acetaminophen exposure. Liver's the target organ. Cats will develop, not all the time, but a puffy face. They'll develop edema in the face or in the paws, which are fairly pathognomonic for acetaminophen exposure in cats. The treatment in acetylcysteine, mucomist, acetadote, Acetalev. These are depends on the exposure and what you're seeing clinically, but these are some of the drugs that we use to treat this kind of exposure. Ibuprofen, again, it's another common anti-inflammatory we see in the house. So this is high on the list of the ones that animals will get exposure to. This one is an anti-inflammatory, so people sometimes assume all the anti-inflammatories like the acetaminophen and ibuprofen act the same, but they don't. Ibuprofen can affect more GI issues. It affects prostaglandin production, so we decrease prostaglandin production, and we see GI issues with these. Cats are more sensitive. Again, don't glucuronidate as well as dogs, so we can see potentially more issues in cats at a lower dose than we do dogs. So the clinical signs can, depending on the dose and the time span that we have, GI hemorrhage and ulcers, tremors, seizures can also be induced by ibuprofen exposure. Some of the clinical sequelae of exposure, especially at a high enough dose to cause problems, are within 12 to 36 hours, we'll see the azotemia, isostenuria, or potentially even acute renal failure. So those are we see those clinical signs that can be caused by a lot of different things, but in small animals, ibuprofen is going to be high on the list. And again, some of on the right-hand side are some of the drugs, some of the things that we use to try to treat these cases, again, depending on where they're at in the clinical syndrome. So the last compound in that list, ILE, intralipid emulsion, is fairly new as far as an antidote. So any lipophilic compounds, if you have access to the intralipids, you can use those to try to tie these lipophilic compounds up and get those excreted. And so it's as far as new antidotes we have, it's fairly new compared to all the other compounds you see on here. Xylitol. Xylitol is a common compound that we see exposure to, especially in dogs. Again, it's a non-sugar sweetener that's used in a lot of different compounds or a lot of different products that we use. So we see that there's a lot of different artificial sweeteners that are out there. Xylitol is the one that we have the most problem with or causes most of the issue. So it's a naturally occurring sugar alcohol. So it's a natural compound. We use it as sweeteners, but it can cause a lot of adverse effects. It's again has a lot of different. It's used mainly as a sweetener, but it can have a lot of different effects. It's for diabetes, a lot of, but diabetic patients can they can use some sweeteners like xylitol without as many issues as other sweeteners. So another reason it's commonly in the household, because it's if you've got type 2 diabetics, that's one of the things they'll try to use in their diet that they can use that won't cause problems. But in animals, it causes significant issues. So these some of these sugars and some of these compounds like xylitol can also be in some normal vegetables and fruits. Typically, when we have issues, they're in other prepared products that animals will get into. The gums, the candy, peanut butter, pudding. If you actually look at the label on a lot of the products that you use in your house, you'll be surprised how often xylitol will show up. So even though as humans we can use these, we don't see any issues with those. Not all animals that get into xylitol will have issues, but it's as far as an artificial sweetener, it's the one very high on the list that we see issues with. So weight loss foods, energy bars, protein powders can all contain xylitol. So for humans, no issue. For animals, dogs especially, it's a big issue. Rapidly absorbed, metabolized in the liver. So it stimulates insulin release very quickly. So a lot of times clinical signs after animals consume this, the glucose, blood glucose goes up very high. Insulin's released as a result of that, and so we end up with hypoglycemia from exposure to these compounds like xylitol or artificial sweeteners. And the species, so it's more than just dogs. No toxicity reported to date in cats, which is good. But you can see my list: rabbits, cows, baboons, which don't normally get exposure to xylitol. They can all have this selective sensitivity to this particular artificial sweetener, the xylitol. So hypoglycemia, when we look at them clinically, usually we may not know that they got exposure to that. We're trying to work up the case and see what's going on. So we see a severe hypoglycemia due to the insulin release. hypokalemia, and then secondary to that, if we get them over the primary hypoglycemia, get them over the initial issue, one of the things that we see commonly is this acute hepatic necrosis after we go through the primary cause. So the acute hepatic necrosis can be seen, as late as 24 hours after exposure. So there's a period of time where we treat the animals, we got them back to normal, everything looks fine, and then they go into acute liver failure because of exposure to the xylitol. And even when we don't see a hypoglycemia, it does not mean we're out of the woods as far as a potential liver failure. So again, when we're working up the case, we like to try to do we try to do some serum chemistry to make sure we can try to see what liver enzymes look like, before we develop any issues 12 to 24 hours after the initial hypoglycemia. Again, trying to look at the liver in 24 hours after, after they show clinical signs, after they appear that they're normal, then we can still have trouble with acute hepatic injury. So trying to get some baseline data, liver enzyme data is very helpful initially, and then monitor the dog to make sure we don't go into this delayed liver failure after the hypoglycemia. So again, it's one you'll see in practice. Can be hard to diagnose. The problem is we can't. By the time the animals show clinical signs, most of the xylitol, most all of it's gone, so we have no way to know that that's what animals got into. So the clinical signs or the secondary signs are usually what we have to base the exposure on, because unfortunately in this case, even with our analytical ability that we have, when animals do start to show clinical signs, there is no xylitol there that we could look at to try to help you make a diagnosis. So some of the treatment, you can see activated charcoal, no. So there are, even though we call it the universal antidote, there's cases when we don't want to use activated charcoal. It's not going to help. It's not going to do what we want it to do. So in particular with xylitol, activated charcoal, we don't use. We're looking at glucose. We want to see the animal become euglycemic, so at a normal blood glucose for 6 hours. And then look at liver enzymes to make sure we're not seeing any issues, to try to make sure we don't develop any issues long term. Another common toxicant that I think a lot of people realize this one, but again, it's odd. When I was in practice, we didn't know anything about grapes or raisins. We didn't know anything about xylitol, but these are common toxins, and there's a lot of variability. So there's a lot of, I hear stories all the time from owners or veterinarians where the owners use grapes or raisins as a treat for their animal and never, have done it for a lifetime of the animal, never had a problem. But we do see that as an issue in dogs specifically. So it's a renal toxin. We don't know the dose. Again, it's not, and a lot of animals can be exposed to grapes and raisins yet have no problem. But the ones that do, again, it's probably dose related, even though we don't know how many raisins or how many grapes they actually have to consume to be an issue. So because it's a renal toxin, the kidney's the target, so we want to look at BUN creatinine to try to monitor where we're at to see if we are getting any damage in the target organ from this exposure. Cats don't know really, not definitive answers whether if they can consume it and not have any trouble, but we don't. Cats typically aren't as high on the list definitely as dogs. So cats, if they got into those, we may still want to make them vomit to try to get rid of any grapes or raisins just because of the potential. Rodenticides, so I want to talk about those a little bit. I don't want to run out of time in practice. Rodenticides are a common issue we see because they're used around the house, they're used around the farms. very common. Pesticide applicators usually will use these around your house, outside areas where usually where animals, they use devices so the animals can't get into it or don't get exposure, but we do see plenty of exposure to these rodenticides, and I want to talk about those a little bit because there's been a change in the last 4 or 5 years from when I practiced. If we had a rodenticide, an animal get into a rodenticide, it was going to be a long-acting anticoagulant. Now that's not the case. So the rodenticides when you see those as baits, if you have an animal that you think got into a rodenticide, you make them vomit, you see these colored baits or colored blocks in the GI tract. A lot of bait manufacturers try to color their baits so that if animals inadvertently get exposed to them, we'll have some idea that they did. But not finding that does not rule out that you didn't have a rodenticide. So, and again, in some of the rodenticides we have are used for malicious poisoning because we get those calls also where the dog's not right, something, they found a bait even out in the yard, and so they've got the owners feel like neighbors have poisoned their animals, on purpose, and so these are very common. You can access these rodenticides anywhere, so they're commonly available and get used inadvertently or by intention for whatever reason we see. So we get a lot of cases where this is what we're looking at. So now what's changed in the last 5 years is that we used to, anticoagulants were the main was the rodenticide that we would see issues with. Now bromethalin was the newest one. Was going to take EPA wanted to pull all the long-acting anticoagulants off the market and use bromethalin as the rodenticide. One of the problems with bromethalin is we don't have a good antidote, very hard to treat. The long-acting anticoagulants, we had a very good antidote that worked very well, was inexpensive, highly available, worked really well. But the anticoagulants are restricted, the long-acting anticoagulants are restricted. So we still see those as an issue potentially, but bromethalin was one of the first replacements, and we still see issues with that. Cholecalciferol, that's a vitamin D product. Vitamin D to overdose basically is a rodenticide. So once they pulled the long-acting anticoagulants off the market, bromethalin was used. We had a lot of trouble with bromethalin. We have no antidote, doesn't work very good, causes a lot of issues. So the pesticide manufacturers took that out of some baits and replaced it with cholecalciferol. So cholecalciferol has become maybe the most common one that we see now. If an owner brings their pet in and feels like they saw the animal get into a potential rodenticide, even if they bring the box in, even if it was something they used and the animal got into it inadvertently, you need to look at the box, look at the ingredients to actually know what it is because of the different kinds of rodenticides that are used. Strychnine, zinc phosphate, zinc phosphide. We see these also. They're still on the market, still causing problems. So the rodenticides used to be easier in clinical practice to try to figure out what the exposure was and how to treat those. And it's in the last 5 years since EPA has pulled the long-acting anticoagulants off the market, it's got a lot more complicated. So we can look at these in our lab. We can try to sort out which one the animals got into. If you give us the bait or blood or tissues, we can help you try to answer what they got into if you weren't able to make that diagnosis in the clinic. So again, these long-acting anticoagulants, we get a lot of owners feel like that's the only one they know. So if their animal got into something and they don't know what it was, if they don't have the box, if they bring it into your practice and they don't have the box, you can't just assume because the owners feel like that's what it is, that's what the exposure is to. Warfarin, so the first generation anticoagulants are still available. The good thing is they're fairly safe. They've got a really short half-life, so they don't cause a lot of problems. Diphacinone, some of the names of these compounds, warfarin, diphacinone are called tomcat, ramic, mouse maze. So so you can't looking at the box with that name on there doesn't tell you what the active ingredient is, because the rodenticide manufacturers still use the same trade name, but they changed the active ingredient. So without having the box to look at it can be very difficult. But again, we can help you sort those out. We've got an anticoagulant screen. I think we've got 10 different compounds on. So we like to get a blood sample to look at, and we can screen that, or we can screen the bait to try to look to see what particular, if it was an anticoagulant and what particular one it was. The second generation ones are the ones that were pulled off the market because they lasted too long. Typically, when an animal got into these, you may have to treat with the vitamin K antidote for 30 days or 60 days because these are protein bound. They get in the liver and stay there a long time. And the reason EPA decided to pull those off the market is because they caused a lot of secondary or non-target toxicosis in wild animals. So there were a lot of wildlife that were being poisoned secondarily, either eating the bait if they got access to it, or eating an animal that had consumed the bait. So secondary exposure was the biggest reason EPA pulled those from the market. And then what we have to replace those with, we had a treatment for the anticoagulants. What the replacement is, we don't have good antidotes for, unfortunately. Again, so the second generation ones, until the last 5 years, these are the common ones, but they are no more. We still see those, but not as common. And so you can look at the compounds again. I just want to caution you that if you look at a box that says decon, you need to look at the active ingredient, because now we don't know if it's bromethalin, if it's an anticoagulant, if it's cholecalciferol. So without knowing, you can't base your treatment on whatever the bait name was if you had it. This is just I'll see if my video plays, a dog that got into a rodenticide. I don't know if can't get my pointer to work. Well, there we go. So this is a picture of a dog with a long-acting anticoagulant. A lot of the times in the past, we'd see pale mucous membranes and dogs that were starting to have respiratory issues because the lungs were one of the first organs that we would see affected. Again, these long-acting second-generation anticoagulants are still around. This is an example of what we typically clinically you would see. And so if the animal was already having trouble trying to getting edema in the lungs and starting to have fluid build up there, they were in serious adverse health. So you'd have to be very quick, be able to make the quick diagnosis, and potentially, one of the things would have to be a transfusion to provide the clotting factors that they need. But so again, these are some of the secondary things you can look at if you think you have an anticoagulant. These are things that 5 years ago, these would commonly look at. Now may not help you at all because they're not pertinent to the rodenticides that we have now. Antidote K3 is not effective. So if you have somebody in your practice that buys your drugs, K3, the menadione, is less expensive than K1, the phenadione that we need. So for an anticoagulant, we need K1, not K3. Again, bromethalin, so it's the one that was engineered to first replace these anticoagulants. So the one we see, it's a CNS toxin. Cats are more sensitive. You can see 0.3 mg per kg, LD50 in a cat, so they're a lot more sensitive than the dog at 2.5. But the CNS damage, we don't have any specific antidote for, so it's supportive therapy. At higher doses, we may see some clinical signs that are a little different than at lower doses. Sometimes we see just leg weakness, ataxia, mild limb paralysis at lower doses. So again, the biggest issue with bromethalin, besides the fact that it's hard to treat, is that cats are exquisitely sensitive to that. So if they do get into bromethalin, they're going to get into trouble at a lot lower dose. The compounds the compound we look at if we think we had exposure to bromethalin is this desmethylbromethalin. So that's in our lab. When we get samples in to look at, that's the compound we're looking at. So we've got instrumentation that we can look at from the bait that you have or tissues from the animal to see if that's what the cause of the problem was. And the lesions, again, CNS, malacia, edema, spongiform encephalopathies. If an animal dies, if we have brain for histopath, that's a helpful histopath findings to make the diagnosis. And again, treatment, we don't have any specific antidotes, so activated charcoal, saline cathartics, trying to move those compounds through. Dexamethasone prolongs survival but does not reverse the syndrome. Mannitol, furosemide treatment. If seizures develop, these are some of the drugs we can use as well. And again, another potential use for the intralipid emulsions. Talked to veterinarians have had good success using these for their antidotes. Vitamin D, so that's the cholecalciferol. That's the third compound, third potential rodenticide that we have now. So that's a common one we see. We can measure. We actually send off if we get a serum sample. We can look at 25-hydroxy vitamin D to see if that's what the issue was. But these compounds, the vitamin D overdose, are very good about upregulating calcium and phosphorus in the animal. So typically there's a delay time with cholecalciferol of 2 to 3 days. So after they ingest it, if the owners didn't see that and the animal's not acting right, when you get into the clinic and do blood work, the first thing you'll see if the animal is having trouble with the cholecalciferol is the hypercalcemia, hyperphosphatemia. These other compounds, other sources, if it's not a rodenticide, there are some lotions that we have, again, that humans use, calcipotriene, vitamin D3 supplements that animals can also get into, besides just the rodenticides. Absorption, again, is fairly rapid. There is a delay period of 2 to 3 days usually from the time they absorb the cholecalciferol to when they show clinical signs, and you can detect that clinically. Minimum lethal dose, it's relatively toxic compared to other things that we look at, 5 mg per kg. Cats are more sensitive again, but the cholecalciferol is probably the most common bait in the rodenticides that we see probably in the last 2 years. Bromethalin is less, and very few long-acting anticoagulants. So one of the problems when they become hypercalcemic is that we see tissue damage, we see mineralization. So the kidney is the first target organ. So we see some renal issues. So if you have an animal, you do your blood work, you see hypercalcemia, hyperphosphatemia, and you see issues with BUN or creatinine, that's not a good sign. So we have to try to get the vitamin D is gone, so we have to try to get the hypercalcemia down as quickly as possible to try to prevent this mineralization in the kidney, lung, aorta, other places in the body where it's an issue. This is just a picture of some of the target organs that we see from the cholecalciferol, hypervitaminosis D. So again, we've talked about trying to make the diagnosis. Clinical chemistries are very helpful. Some of the differentials would include this hypercalcemia of malignancy, chronic renal failure, but typically you may not see the hypercalcemia, hyperphosphatemia that we see with the cholecalciferols. Treatment, they have some specific compounds. These pamidronates are the compounds that we like to use. Calcitonin, salmon calcitonin was one we've used in the past, but we do have some compounds that you have to use maybe for 2 to 3 weeks to try to get the calcium down so we don't have issues. And again, these are, when you look at the compounds, or you look at if owners feel like their animals got into a rodenticide of some kind, if you don't have the bottle to look at that they gave, you have to be very careful about assuming what they got exposed to. This one I wanted to include because we see that maybe not as common as some of the some of the other rodenticide baits that we've talked about, but strychnine, natural compound, indole extract, nux vomica, used usually for animals under the ground. We see more problems with this for gophers or underground animals. But again, you can go to most farm and home stores, and strychnine is going to be listed on some of the ingredients. It depends on what you want to use. So we still see that. These are some of the just examples of baits that were used, people that have baited animals intentionally with this strychnine compound. Just a picture of a dog, clinical. They get the sawhorse stance, rigid extension, rigidity. It's absorbed fairly rapidly, very serious toxicosis. Again, it can be when we talk about the rodenticides, it can be on that list. So don't forget about strychnine being an issue. If we have any questions now, I can try to take any questions. If we don't have a chance to cover those today, you can always call up. Dr. Fritz and I are both available. We can answer questions. And a lot of times with toxicology questions, we try to be available. The problem is with toxicology, most of them are acute issues happening very quickly, and so you need to get an answer. The pet poison hotline, the call-in hotlines are available as well. They charge a fee for their service. A lot of people use those, and they're good. They do a great job. But they don't do much with diagnostics. They're more treatment. If the diagnostics are the question, usually you have to call a veterinary diagnostic lab or an analytical lab to see what you can do to try to confirm your diagnosis. So
Steve, we do have some questions. Number one, if we suspect a small animal or companion animal has been exposed to a poison, is there a test screen that will identify the common ones?
So what we like to do, if you can, is get a blood sample, or if you make the animal vomit, collect the vomit. That's critical that we can look at that, especially for the acute toxicosis. So if we can get a sample early on, especially vomitus, we have our GC mass spec screen that we can do that's very, very effective, and we have a high possibility that we're going to be able to identify what the animals got into, even if you have a successful treatment and they get over that. If the owners want to know, or if you want to confirm whatever you thought your diagnosis was, we have a good way to do that.
Another question, what is the percentage of dogs that actually show signs of renal failure that eat grapes?
So it's not that high. We don't know exactly what the toxin is. We don't know why some dogs, again, cats probably not really. We don't see that as a renal toxin in cats, but in dogs, there's no way to screen to see if your dog's sensitive or not. But again, I'd say in the cases we see through the diagnostic lab, maybe 20% of the animals that got into grapes or raisins could potentially be exposed. But there's no way to really know. And I know people that have used or fed, used those for a treat in their dogs and never had trouble, and then the dog's, been exposed to that, for quite some time, and then, can have an acute episode with renal failure. So.
Another question, does biosponge have any efficacy similar to activated charcoal?
The
Biosponge.
biosponge. So they do have some other products that are absorbents, like the activated charcoal or cathartics. So yeah, some of those have some value. In general, we just talk about activated charcoal to absorb the toxin, and then we try to leave it there for an hour or two, and then sorbitol or some kind of a compound to try to move it, what we didn't absorb or didn't evacuate by vomiting, get it to move it through the GI tract.
Treatment of iron poisoning with hand warmer ingestion. Are they toxic, and is AC effective?
Right. So so iron, we do see a lot of issues with iron. We do see, even iron supplements that the humans take in the household, animals get into, and animals as well as humans we don't have a good way to excrete that. So we do see issues, GI issues with potential, hand warmers with iron or other potential sources of iron, because it's it can collect in the liver, and liver can be a target organ besides the GI issues that we see. So iron, I didn't mention iron, but that's one we see issues with. So.
And again, what is your recommendation for time to use an emetic?
So typically, when we talk about it with students, we always say if we know the dog, if we know what they've ingested, we can decide whether we want to make them vomit. Typically, we do, but if it's a caustic compound, if it's a highly acidic type compound, once they've ingested those, we don't want to make them vomit, because if they're in the stomach and they haven't damaged the esophagus, we don't want to try to induce vomiting and have a potential to get stricture issues or damage to the esophagus that they don't have now. So in general, if we don't know, one of the first things we do in a lot of cases will induce vomiting if we don't know, assuming that it's not going to be a caustic compound or anything that's going to cause any secondary damage. And then if we can, the activated charcoals, they're relatively safe. The biggest issue is trying to make sure, if we're going to use those, that we don't get any in secondary inhalation issues with trying to gavage them with activated charcoal. So again, with veterinary medicine in general, ideally we do no harm. So we whatever you do, you have, you base your decisions on your best practice experience and do what, use your best judgment.
So the question is, do not induce vomiting with hand warmers?
Well, it depends. In general, that's the trouble. All the hand warmers aren't the same, so we don't know if it's a hand warmer that we've got iron in. I would probably try to get him to evacuate. Try to get him to get that out of there, because we don't want to absorb any more than we have to. But again, there's, those are hard questions to answer, in practice too, because we don't, you don't know what they got into. Even with a radiograph, you're not sure exactly what they've got. And a lot of times the owners, are not always the best source of answers, because they don't always see what actually happened, or, they interpret what they see based on, maybe inaccurate facts. So you got to be careful, and everybody, you need to listen to the owner. I'm not saying they're not a good source of the history, but you have to weigh what they, what they're telling you to base your treatment based on that.
Another question just came in. Is there a higher risk of toxicosis with one versus more than one grape ingestion?
So if they're sensitive to it, yeah, I think, even with one or two, even at low doses, because we don't know what the dose is. I mean, there's been cases where, the owner said they didn't think they got very many, or got exposed to very many, but were even a handful of raisins or grape were able to cause an acute renal failure issue. So because we don't know, there's a lot more we don't know than we do know. That the bottom line is, try, in general, that's not a good, not a good source of a treat or anything you want to give them intentionally.
So I think you said that for most compounds, an emetic more than 1 to 2 hours after ingestion is probably not going to be
right. So that's
effective.
kind of our golden window of time, unless it's chocolate, because chocolate ingestion is delayed, up to 5 to 6 hours. So if if at Easter time your dog eats the Easter bunny and it's 5 hours afterwards, I'd still try to make him vomit. And it's the dark chocolates, the baker's chocolates, so there are issues, not most of the chocolate compounds that they get into. We don't want them to ingest too much, but they're relatively safe. But the dark baker's chocolate, or when we get into things that have been baked and have high concentration of those compounds, that's what the issue is.
So what's the dosage for activated charcoal?
So there really is no specific dose. It depends on the size of the animal. Again, if we've usually, if we're going to evacuate, if we've had good success with vomiting and we feel like they've emptied the stomach out, you may not have to use it. Sometimes, with repeated dosings with activated charcoal has actually caused some adverse signs too. So again, based on the size of the dog, we'll base that on how much charcoal we try to give.
And then one last question. Do you know why it took the EPA so long to take the long-lasting anticoagulants off the market?
Well, there's just a lot of controversy about, ultimately they were pulled because we did a poor job of trying to control secondary exposure. So we had too many wildlife exposures. But because we still see, when we look at, we get actually samples from raptors and some other animals that we still see some of these. With a screen that we can do, we can look very easily. We get samples from a group of wildlife people on the East Coast that are looking at a lot of wildlife, and we, even though it's been 5 years now since the original EPA tried to pull these off the market, we still see issues with those. So, but the trouble is the ones that we have a replacement, clinically are a lot harder to treat. So, we won on the exposure to wildlife issue, but then, it's made it much more difficult clinically to try to treat these substitutes that we have.
Okay. Can you advance your slide, kind of show the last two slides?
Oh, sure.
Just as a reminder, everybody, that you will receive a CE certificate for 1 hour of continuing education. We'll email that to you. Yeah, that's our production team, so thanks a lot for everything they do. And then also we will put, next slide, please. There we go. We will put this recording on our YouTube channel. So again, just Google KSVDL YouTube and it'll be planted there. Another thing that I forgot to mention, you'll be asked to fill out a short survey. Please fill that out. Number one, it'll help us improve our product, but also it'll give you an opportunity to tell us what topics you would like us to cover and what kind of specialists you'd like us to bring in for these webinars. So it's about 2 minutes till. So appreciate again Dr. Steve Ensley for being here. Great presentation on toxicology, and for all of you joining us during your lunch hour, or during our lunch hour anyway. So we'll see you next month. We'll have another one next month on a totally different topic.